Hello everyone, welcome to our Zoom meeting. Today we're gonna discuss a couple of topics, and the first presenter will start. So here we go. When you are ready, please go ahead.
Yes. Hi, my name is Dr. Shumaila. Me and Dr. Olivia will present today the relationship between the osteoporosis and the microbiome, the relationship between the gut bone. So, what is the normal bone function and development? So, bones are the living tissues that perform many important functions in the body, including now three types of bone. Structure bone provide a strong framework that supports the body and protect the soft organ like brain, heart, and lungs. They also work with muscle to allow the body to move. Second type of bone, storage bones. They will store the minerals like calcium and phosphorus, as well as the growth factor and cytokines. They also house the bone marrow, which produces the blood cells. Third type of bones, that is the protections bone. They will protect the vital organ and structures. Now, the formation of the bone, endochondral ossification and the intermembranous ossification. Endochondral ossification first, that occur with the replacement of the cartilage with the bone. Prenatally, our cartilaginous structures develop that will serve as the template for the ossification. And what is the intermembranous ossification? Bone formation that occur with the replacement of connective tissue with bone, but in the absence of the cartilage. And example of this bone is skull bone, responsible for increasing the bone diameter. Now, this is the endochondral ossification. First, that is the mesenchymal cells are there. They will produce the extracellular matrix. Extracellular matrix will differentiate. Centrally located chondrocyte will stop proliferating and there will be the hypertrophy. There is the extracellular matrix modification and vascularization. Continuous osteogenesis and formation of the secondary ossification center. After that, there is a fusion of the primary and secondary ossification center and formation of the articular cartilage at the epiphysis. And in the intramembranous ossification, we see we don't have any cartilage. So these are the membranous formation. And through that, there is the skull bone. The example is the skull bone. Now, what is the osteoporosis? Chronic metabolic bone disease characterized by the decrease of bone tissue per unit volume under the combined action of genetic and environmental factor, which lead to the decrease of the bone strength, makes the bone brittle, and raise the possibility of the bone fracture. It causes bone to become weak and brittle. The body constantly absorbs and replaces the bone tissue. With osteoporosis, new bone creation does not keep up with the old bone removal. There typically are no symptoms at the early stages of bone loss. Once bones are weakened by the osteoporosis, symptoms may include back pain, stoop posture, loss of height over time, and bones that break easily. Now, the rank L and its association with the bone health. How is the regulation of the bone remodeling? Osteoblast, cell that build the new bone, also produce the rank L. Tightly control the balance between the bone formation and resorption. Osteoproteogranin, this is the natural decoy receptor that bind to the rank L, prevent it from interacting with the rank and inhibit the osteoclastic formation. Balance between the rank L and osteoproteogranin is crucial for maintaining the healthy bone density. Now, this is this is working. So we have two type of cells are there. One is the mesenchymal stem cells, other one is the hematopoietic stem cells. Mesenchymal stem cells will form the pre-osteoblast. From there, the pre-osteoblast has both rank and rank L. Osteoproteogranin will come and join with the rank L and inhibit the osteoclastic activity. And the same how they form the hematopoietic stem cells, they form the osteoclastic precursor and do the osteoclastic activity when they join with the rank and rank L. This is the section of the bone which is showing the osteoporosis. You see, normal bone is quite thick and osteoporotic bone is brittle, broken, very fragile. Sign and symptom. What are the sign and symptom of osteoporosis? Because the osteoporosis has been called the silent disease, bone mass is lost over many years with no even clinical signs. Clinical manifestations are loss of the height, vertebra can collapse or compress due to the weakened bone, leading to a noticeable loss of height. Second, back pain that can be persistent, so sudden onset of back pain. There will be the vertebral collapse that is called the Dwagger's arm. There will be the stoop posture, kyphosis, abnormal curvature of the spine, decreased mobility, decreased ability to perform the everyday activities, bone fractures with minimal trauma, weak and brittle nails, nails become more brittle or breaking more easily. Diagnosis of the osteoporosis. So there are the many methods with how we can do the diagnosis of the osteoporosis. First of all, there is the X-ray study. It will determine the bone study. Second, radiograph. It will show the bone mass, osteopenia. Third, ultrasound. It will show the bone density. Then there is a DEXA scan which will determine the bone mineral density. That is then the T score. That is the comparison of your bone density to that of your healthy young adult of the same sex. A T score above -1, normal bone density. Between -1 and 2.5, osteopenia, low bone density. Below -2.5, osteoporosis. Z score. This compare your bone density to what is expected in someone of your age, sex, height, and ethnic or racial origin. Z score below -2.0 may indicate a problem. Prevention. How we can prevent the osteoporosis? Main goal of the treatment is to prevent the development of the osteoporosis and to stabilize the remaining bone mass. We do the exercise regularly. Avoidance of the alcohol, caffeine, and smoking cessation. Patient with the eating disorder should receive the appropriate treatment. Adequate vitamin D and calcium. Create same home environment. Adhere to the proper screening and monitoring. Take the prescribed medication instructions. Most commonly, bone resorption related to the estrogen level and old age. Can be secondary to the drugs also. Steroid, alcohol, anticonvulsants, anticoagulants, thyroid replacement therapy, and many other conditions like hyperthyroidism, and multiple myeloma. Now we come to the drug therapy. So first, there are many drugs actually. So first is the bisphosphonate, that is the alendronate and zoledronic acid. Parathyroid hormone analogs, that is the teriparatide. Monoclonal antibodies, that is the denosumab, romosozumab, calcitonin, SERMs, especially raloxifene, hormone replacement therapy, estrogen combined estrogen progesterone therapy. The choice of the drug therapy depends on several factors, including the age, sex, bone density, fracture history, and any other existing medical condition. Side effect. Each medication has potential side effect which must be considered when choosing the appropriate therapy. Duration of the treatment. Some drugs are intended for the long-term use while others may use for the shorter duration. Now the gut-bone connection. Microbiome relationship to the bone. How gut affect the bone health? Nutrient components, inflammatory factors, and hormone environment play the important role in bone metabolism. Recently, intestinal microbiota has been found to influence the bone metabolism via influencing the host metabolism, immune function, and hormone secretion. Now, gut microbiota. There are many factors which affect on the gut microbiota and further gut microbiota, how it acts like that. So host factor, basically genetic background, our gender, environmental factor, that is the diet, lifestyle, hygiene, antibiotics, and probiotics effect on the gut microbiota. Now, how the gut microbiota act? It affects the immune system. It affects the CD4 plus T cells. It affects the pro-inflammatory cytokines. Then it affects the endocrine system. That is the IGF-1, parathyroid, and growth hormone, gonadal steroid, and serotonin. And then it affects the calcium balance. There is a transcellular transport, paracellular transport, and intestinal lumen pH. So all these factors will affect the bone metabolism. Nutrition absorption. The gut microbiome help absorb the essential nutrition like calcium, magnesium, vitamin D, crucial for building and maintaining the strong bone. Healthy gut bacteria improve the efficiency of these nutrition absorption process. Based on the gut-bone axis, dietary nutrition absorbed by the gut through the metabolic process of gut microbiota could further act on the bone, inhibit the bone resorption, promote the bone formation, and reverse the bone loss. Here come the beautiful picture. So now these are some factors which affect the gut microbiota and how it acts. When we eat the healthy food, like eating the rich food in high in the fiber, supplemental calcium, vitamin D, probiotics and prebiotics, ingesting the anti-inflammatory rich in omega-3, low fat, low carb food, and ingesting the appropriate amount of the grains, these all gonna affect the gut microbiota. How it act now? Will increase the small chain fatty acid, bifidobacteria, lactobacillus, provitala, bacteroides, Akинmansia, Roseburia, Streptococcus, increase the interleukin 10, Firmicutes decreased, E. coli or Remicoccus and Coprococcus, these all bacteria will be decreased. Decrease the TNF alpha, interleukin 1 beta, lipopolysaccharide and C reactive proteins, they will decrease and we will get a healthy bone. Now, we eat junk. Ingesting food which is very high in fat, sugar, salt, and calories affect the microbiota. What will, with the action of the microbiota, then it will induce the osteoporosis. How? Will increase the bile acid, biophilia, Bacteroides, Firmicutes, E. coli, Klebsiella, Shigella, Enterobacteria. It will also increase the lipopolysaccharide, then trimethylmanamine and trimethyl N oxide. Decrease the small chain fatty acid and bifidobacterium, lactobacillus, bacteroides, enterococcus, and lactic acid and form the osteoporosis. Gut microbiota, different things and again act on the gut microbiota like diet, antibiotics, probiotics, and prebiotics. And then gut microbiota basically act on the calcium metabolism, immune system, and gut-derived serotonin. When it acts on the immune system and calcium metabolism and gut-derived serotonin, it will affect the bone. Now, the regulation of inflammation. A gut microbiome is a regulator of bone and skeletal development. Any change in the microbiota composition lead to decrease the composition of calcium and contribute to the pathological bone loss. Disorder of the intestinal microbiota will increase the permeability of intestinal cell, which cause more lipopolysaccharide into circulation. Lipopolysaccharides can upregulate the inflammatory mediators like interleukin 1, COX2, TNF in the bone metaphyseal region. Disorder of the intestinal microbiota can increase the gut pH, decrease the calcium absorption. Diet can change the species of the intestinal microbiota. High fiber diet and fructooligosaccharides can increase the number of the bifidobacterium species. The intestinal microbiota can affect the host metabolism through a variety of ways to influence the bone turnover. Now, when there is a depletion of the gut microbiota, it's a blurry picture actually. So how it affect? First of all, it will cause a chronic inflammation. It will affect the lipid metabolism and innate immunity and lead to osteoarthritis. And when it affects the intestinal barrier function, endocrine function, immune function, and gut microbial excretion byproduct, it will lead to the osteoporosis. Now, from here, Dr. Olivia will present.
So, thank you so much, Dr. Shumaila. So now the research highlight, there has been so many research going on why the patient having osteoporosis related to the gut microbiota. The number one is the lipopolysaccharide and lipopolysaccharide binding proteins were associated with the low level of a chronic inflammation. The bacterial cell wall composition of a lipopolysaccharide and endotoxin, which mainly found in the gram-negative bacteria, they stimulate the inflammation and therefore they activate the transform growth factor. And then toll-like receptor. So disorder of intestinal microbiota, they increase the permeability of the intestinal cell, therefore more lipopolysaccharide into the circulation and This leads to metabolic dysfunction and chronic inflammation. The second is the bile acid, so which is which is known as a gut liver excess through the fragile X protein, and then transformed growth factor 5 signaling stimulation of a TGRF5 can increase the production of a glucagon-like peptides. They can active thyroid C cells, secrete the calcitonin, and therefore inhibiting the bone resorption. GLP-1 also can stimulate the proliferation of osteoblasts and inhibit the osteoclast. In case of LCA, if the lithocholinic acid, that is known as LCA, if it is can damage the osteoblast and mitochondrial and reduce the cell viability. The lithocholinic acid can reduce the gene expression of a osteocalcin and rank ligand. Next is the short chain fatty acid. They are ability to influence the track gene development through the membrane protein known as a SLC5, 8, and GPR41 and GPR43 and GPR109A that promote the anti-inflammatory environment by inducing the apoptosis of the inflammatory cells. The next is microbiota and the immune cell system. They have a very important role in order to balance the skeleton system by evolving the field of a bone immunology, osteomicrobiology. The balance between the bone formation and resorption is critical for maintaining the bone density and strength, which is known as a bone homeostasis. Disruption in the gut microbiota that can lead to imbalancing, favoring the bone resorption and increase the risk of a osteoporosis. Now, next is the Th17 and TRAC cells. So cytokines like interleukin-17 that increase the activity of osteoclast, that is a bone resorbing cells, and overactivity in Th17, often driven by gut dysbiosis, lead to excessive bone resorption and therefore bone loss and lead to osteoporosis. TRAC cell played a very important role for the immune tolerance and controlling the inflammation. The production of anti-inflammatory cytokines such as interleukin-10 that help to suppress the osteoclast activity and promote the osteoblast, which we needed for the bone building mass. For example, the Clostridium genius, bacterial antigen, and the TGF-beta rich environment can result in the expansion of the systemic tract. The neutrophil to lymphocyte ratio that bind to the bacterial peptide and attract the receptor interaction protein RIP2 stimulate the NF-kB signaling pathway that induce the osteoclastogenesis through the chemokine and cytokines. Now look at this picture. Oh God, this is how to show. So we can see here. So one second. So we can see here there's a osteoclast precursor to the becoming osteoclast, either by the having TRAC cell, that is a cytokine with the help of a cytotoxic T lymphocyte antigen 4 and interleukin 10, and the TS17 cell with the help of interleukin 17 and rank N. So what happened when the TS17 cell and that stimulate the interleukin 17, then rank ligand, they induces the more production of the osteoclast. So here we can say how the bone resorption occur because of if the patient having osteoporosis, rheumatoid arthritis, and periodontitis. We can see here the Th17 cells are more as compared to the TRAC cells. So therefore, the bone reabsorption are going on. Whereas in the right side, we can see when the patient we are giving treatment for osteoporosis or rheumatoid arthritis or periodontitis, we can see there is a few number of Th17 cells and more is the TRAC cells. So there's a more bone formation is going on. Now, the another pathway is a NOD1 and NOD2 signaling. So NOD1 and NOD2 signaling pathway are closely associated with the bone health through their roles in the immune response and inflammation. Chronic activation of this pathway increase the osteoclast activity, so more bone absorption going on, and therefore osteoporosis occurs. Inflammatory cytokines such as TNF, alpha, interleukin C6, they also promote the osteoclastogenesis, and therefore the osteoclast is forming too much, and this lead to breaking the bone tissue. Now the node 1 and node 2, they activated by the microbial molecule which is known as a muramyl dipeptide, were most generally found in the gut bacteria. When these receptors detect microbial component, they trigger the immune response that lead to chronic inflammation, the releasing of cytokines, and contribute to bone loss. So there is a next is the WNT signaling pathway, which is very important, complex network protein. They transmit the signal for the cellular process. So WNT protein, they bind to the Fizzle receptor and the LRP56 co-receptor, which are presenting on the transmembrane receptor. So they binding the once they bind, they prevent the degradation of beta-catenin that allow to accumulate in the cell nucleus and promote the transcription of the targeting gene, which are very important for the bone formation. Certain gut bacteria, they produce the short chain fatty acid and other bioactive compound. They also enhancing the WNT signaling pathway, which we needed for the bone formation. However, an imbalance in the gut microbes that is known as dysbiosis can disrupt the WNT signaling, leading to the osteoblast, reducing the osteoblast activity and therefore impair the bone formation. Now we can see here the WNT, once they as we discussed before, the WNT, they bind to the Fizzled and the LRP56. Here, the osteoblast is releasing DKA1 receptor. Here, the osteocyte, they are releasing the sclerostatin, which is inhibiting they preventing this combination, the binding. So, but we need WNT and this receptor in order to make the beta-catenin. So, beta-catenin having important role to make the osteoblast precursor, which we needed for the osteoblastogenesis, and eventually the osteoblast occurs and they increase the bone formation. However, at the same time, beta-catenin, they inhibit the osteoclast activity, and therefore osteoclast activity decreasing, and we decrease, and therefore they decreasing the bone resorption. Now the lecithin, then the sex hormone, and serotonin, how it plays an important role for the bone. Lecithin are protein that found in the foods such as legumes, grains, and certain vegetables. So lecithin can disrupt the gut health by increasing the intestinal permeability because it makes the leaky gut, and therefore impair the nutrition absorption and impair including such as calcium and vitamin D. Lecithin-like domain inhibit the osteoclastogenesis and inflammatory bone loss, which are a specific domain known as a lecithin-like domain, which plays very important role for preventing or reducing the formation of osteoclast. So therefore, less breaking down bone, and that will help to mitigate the bone loss caused by the inflammation. Now we can see here in the picture, the lecithin brings the benefit to bone. So we have a hematopoietic stem cells that is working on the myeloid progenitor, and that the monocyte pre-osteoclast and eventually the osteoclast going on. Here in the in bone, the osteocyte, they're releasing the osteoblast, which also with the help of a RANKL, they also stimulating the osteoclast activity. So suppose, and here the galectin, they also stimulate the RANKL. If we give drug like denosumab and bisphosphonate, they inhibiting the RANK ligand, so osteoclast activity is dropping. On the right side, we can see the skeletal stem cell. They stimulate the chondrocyte and the stromal cells. Chondrocytes, stromal cells, and osteoblast, they all act on the receptor like CLAC11. With the help of this, the WNT and vascular endothelial growth by BMP and HEDOC genes, they stimulate the osteoblast progenitor, and that's how the osteoblast process going on. Now, how the sex hormone works. Estrogens play a very crucial role to maintain the bone density by inhibiting the osteoclast activity and promoting the osteoblast activity. In men, testosterone, they help to maintain the bone mass. If there is a hormonal imbalance in sex hormone, in that condition, if the patient having low estrogen or testosterone level, they accelerate the bone loss and leading to osteoporosis. We can see in this picture, if patient having a estrogen deficiency, that decreases the BMP and WNT pathway that we needed for mesenchymal cell to make the osteoblast. And when we are having less WNT, then we know that is the vice. Conversely, we are having too much sclerostatin and DK more. So that will also that will also inhibiting the rank L and the OPG. And here the osteocyte here, when they're having estrogen deficiency osteocyte, they also work, they also stimulate the rank L activity and decreasing the OPG. And therefore the osteoclast activity is increasing, the bone resorption is more and the bone loss is more. When patient having estrogen deficiency, TGF beta decreasing, interleukin 7 increasing, and reactive oxygen species is increasing. TGF beta and interleukin 7, they stimulate the T cell activation and then it will increase the rank ligand and therefore the osteoclast activity increasing and bone resorption increasing. Here in the reactive oxygen species, when it's more than TNF alpha is more and then also work on the osteoblast and then the bone loss going on. Now we can see in this picture bones and the sex hormone. We can see insulin, which act on the hepatic lipid, genetic variability, obesity, anticonvulsant drug, anti-hypothyroid, and aging. They all work on the liver by releasing the sex hormone binding globulin. And sex hormone binding globulin, as we know, it always bind with the estrogen or testosterone. Here we can see testes is releasing the testosterone with the help of aromatase, then estrogen, and then estrogen, as we know, always act on the liver. And if suppose there is less binding, the trabecular thinning is going on, and that's how the osteoporosis occur. And we can see in the periosteum also thinning. Now the serotonin. The majority of bodies, serotonin is produced by gut. So it negatively affects the bone formation by inhibiting the osteoblast. Elevated level of a gut-derived serotonin, they link to the reduce the bone mass with a higher risk of osteoporosis. We can see in this picture, in the flow chart, the GI tract, the endochromatin cells, which are derived in the gut, they act via the platelets and then the pre-osteoblast, it makes. So gut-derived 5-hydroxytryptamine inhibit the osteoblast proliferation, reduce the bone formation through the activation of a 5-STR receptor. So there are the clinical evidence like probiotic and bone health. The clinical trial has shown some specific probiotic strain positively affect the bone density by potential therapeutic application for osteoporosis. And there are some animal studies shown that indicated that manipulating the gut microbiome can significantly affect the bone density by providing the insight into the potential treatment strategy for the osteoporosis. Future direction, we have two types of personalized medicine and gut microbiome modulation. Ongoing research is exploring the personalized approaches to the osteoporosis treatment based on the individual microbiome profile. And in gut microbiome modulation, investigating how the diet, probiotic, prebiotic can helpful to modulate the gut microbiome in order to prevent osteoporosis. So in conclusion, we have an interconnected system. The emerging this research clearing that demonstrate a significant link between the gut health and the bone health, highlighting the microbiome role in regulating bone density and overall skeletal integrity. Influencing on the bone hemostasis, it impacts through the multiple pathway, including nutrient absorption, immune modulation, hormonal regulation. Disruption in these pathway can lead to bone loss, increase the risk of osteoporosis. Then next is the therapeutic potential. Understanding the gut bone connection opens the new avenue for preventing and treating the osteoporosis. So, modulating the gut microbiome through the diet, probiotic, targeted therapy can be effective to support the bone health. Future direction, continued research is needed in order to explore different approaches for the osteoporotic patients and on individual microbiome profile. The potential for the gut microbiome modulation non-invasive intervention for osteoporosis is promising and warrants future investigation. Holistic approach to bone health is very important in order to management, prevention and treatment. Underscore the importance of holistic approach to bone health, considering the interplay between diet microbiome and overall wellness. So question, we invite any question, comment, or throughout the thought you might have about the connection between gut microbiome and bone health. Feel free to ask me, aspect of the research potential treatment option or any other related topics that interest you. That's all. Thank you so much. Hello.
Thank you, both of you. This great presentation, and thank you for sharing all this new data. It's an
Thank you
important
so
topic.
much.
Yeah,
Yeah,
it's a
thank you
new
so much
topic.
for that. Thank you. Okay.
Thank you, both of you.
Thank you, Dr. Nadir.
Thank you, Dr. Olivia and Shumaila. Any comments? Dr. Sana, do you have any addition?
No, thank you.
Any questions for the presenters or any other comments or questions? If not, maybe we can move on to the next topic. And I'm going to move the agenda a little bit. So we have Dr. Sumi Dey, and she is one of the fellows in our program, first batch. So she is joining us to share her experience, but a brief introduction. She did her residency and in Detroit or doing it. Before that, she was working at MSU, Michigan State, but in Grand Rapids, so it's a different city. And she published a number of articles. She presented, I think, some cases. Her hospital was in Detroit, Henry Ford, and also she has about 32 publications with 205 citations. So she has significant impact. One of the things that she started writing when she initially started writing this piece, it's time to serve as a primary care physician. And it's important topic for medical students to understand the need for primary care physician. And this also goes for you guys, international medical graduates. There is a big need for primary care physician in this country nowadays. And she also got funding from the government for a vaccination project during her fellowship with our program. And that was great. And that was also mentioned in the international journal, I think. But she may talk about this furthermore. Without ado, Dr. Sumi, please go ahead and share your experience. Thank you.
Thank you, Dr. Nadir, and thank you, everyone. Thank you, Dr. Nadir. I even did not know about myself this much. It was really a very nice introduction and all that. All the students and whatever the future resident, This is a very, very nice platform, and I'm really honored to, be invited by Dr. Nadir here. I'm so sorry that I couldn't make my time probably earlier. As you all, like during residency time, it is like never you can find a time for yourself. But I definitely very glad to be here today that I'm able to, manage my time and able to join and meet you, all of you. I was hearing your presentation. I think it was Dr. Dutta, and I was not able to figure out the other doctor probably. But yeah, it's very nice presentation. And I'm so glad to see that the program has expanded a lot, because when I think I was in the first batch, if I'm not wrong, when Dr. Nadir has started this one, and it was literally a 9 fellows. Basically, it's all over the world, but which is like a great opportunity to learn. And I had experiences a lot of things from here, which I'm going to share with all of you, if all of your time permits. Also, like I will I would be able to probably get some questions from you, all of you, because I would like to know that what you guys would like to know from me, because it's not sharing about my experiences, but I know you guys might have some questions which probably I'll not cover. So it has to be interactive session, I guess, if your time allows. And also about this fellowship, like let me talk about, although Dr. Nadir mentioned more than enough about me, but I definitely, I believe that most of you guys are here as a foreign medical graduate. I'm assuming probably some of you could be American medical graduate as well. But like all of you guys, I'm also a foreign medical graduate, and after finishing my medical school from Bangladesh, I joined my husband here in Michigan. So I know like what are the struggle you guys are going through. I was in your shoes not too long ago. It was a great journey, although it was very, I would not say painful, but at times it was painful. So much ups and downs, frustration and whatnot. But do never lose hope. Never lose your confidence. That's all I can say. If you are dedicated, and you know that you can do it, and you are there, you already have come through a lot, and you already reached here. So please do not give up your dreams. Based on your each of us has a unique situations, but believe me, trust me, like no situation is every situation is solvable. And based on your situation, work on those. That's why I'm telling, like, you guys probably have more questions for me than I do have, because each of your situations are different. So long story short, I came here, and I started taking my exams. But as like by the time I came here, with I have a family, and I gave birth my children, and then I was a little bit like far away from the graduations. So I knew that when I'll be applying, I'll be out of 5 years from my graduation, so I need to improve my CV. So I started work on earlier than later. So like when I started preparing for the exam, I also started preparing for my applications, because I knew that when I'm going to be applied, I have to have my application very strong in order to qualify that. Also, I have another limitation, because geographically I am intended to only one couple of the programs, because of my family. I was only able to apply in Michigan, and then surroundings state. So that was my another limitation. But with all these limitations, all these negative things, also I made my CV, I feel like, very strong. I was still able to match in my first choice, and in my literally 20 miles away from my home. So that's why if I can make it, you all can make it. I know that you all are smarter than me, at least, So it's all your dedication, your hard work. But the things is, this game is very, very competitive, and you have to play this game with very intellectually and very carefully. So that's all I would like to talk about it. Like, when I matched in my program almost, I think second time or third time, but I keep continuing my CV strong year after year, and then I try to see like why I'm not getting matched and whatnot. So and my goal was when I matched third time, I want to make sure my CV is the best CV, and there is nothing that program director can tell me that you have lack in these things in your CV. And believe me, trust me, like I got the same opinion from my interview. After my interview, the program I'm doing residency right now, literally the program director and email back to me for my thank you letter that, oh, your CV is outstanding. I don't know, what you have lack and why didn't you match last year? So, I try to tell you that, please utilize your time, the most you can do, but also utilize your time that which things is necessary for your CV and for your experience and whatnot. So currently I'm a third year resident in family medicine in Detroit, in a Detroit program. Before joining residency, I did a master's in global health from Michigan State University College of Osteopathic Medicine. I also did a research fellowship from Spectrum Health, which is currently called, I think, Corewell, which is also affiliated with Michigan State University. Also, I worked as a research specialist at University of Michigan, Ann Arbor, where I had the opportunity to publish a lot of papers. And I also, went to multiple conferences. Also, with these experiences, I suggest that this is the very good experience. And also, I joined Dr. Nadir's telegeriatric fellowship. I also published here a lot. Literally, I think I published 4 or 5 abstracts from this telegeriatric fellowship. Also, one of my paper, because that was a top in pandemic, I think peak pandemic times, if I'm not wrong, around 2021. I think at that time, me and Dr. Nadir and a couple of my co-fellows, we all published a paper, a abstract about COVID pandemics and the comorbidities, most specifically about the geriatrics population. So that paper, actually, that abstract was indexed by WHO, World Health Organization. So, that question, I think my program director noticed that my abstract was indexed by WHO. And, I had to really explain to that, how did I gather data? Who was my principal investigator for this data? So I'm proud of that Dr. Nadir gave me that opportunity. And I'm sure that really helped me for my residency as well. So, that's pretty much that. And during my master's program, I also developed a research project, and that research project, as Dr. Nadir was talking about, that research project actually for how to overcome vaccine hesitancy among underserved population. And that's the project actually I did. The hospital currently I'm doing residency, so they are very impressed about my program, and I got a grant for that program. And I'm really, that program was very, very helpful for my residency, because that's how I developed how to prepare a proposal and how to get a grant. Although this was a very mini grant, it's not a it's not a it's $1 million project or nothing like that. But of course, it's I would say it is more beneficial for my CV that I was able to manage a grant, before residency. So that was the thing was, at that time, the vaccine hesitancy was very, very crucial, and that overcoming vaccine hesitancy was very, very important at that time. So I think it's my luck also that I picked that topic, and then it was the right time in the right place. So that's how I was able to get residency over there. So I will be finishing my residency in this June, and I am from the beginning, my goal was to join as a faculty. I think I worked for that. That's why you can see my CV is completely mostly an academic kind of CV, because I try to publish, and I have also a public health master's program, because I thought that would be helpful for my future career. So I will be joining in a Detroit residency, family medicine residency program in a clinical faculty in a couple of months. I'm excited for that, but at the same time, it's a lot of new experience. But with that, I would definitely, I know that I already talked a lot about all these things, but I'm ready to answer any questions if you guys have any questions about residency preparation. And of course, like if you guys have any question about interview preparation, or how do you prepare yourself, or if you don't match, what would be your next step? You can, anyone can ask me any question. Thank you.
Thank you so much, Dr. Sumi. And the floor is open for questions. Please go ahead or raise your hand and go ahead with your questions. I'm going to start with just a simple question. So while you are preparing your application, you did some rotations like clinical experience?
Absolutely. So basically, as I mentioned, that when I was working at University of Michigan as a research scientist, so over there, I met with a lot of physicians basically. So my mentor was an oncologist, but I knew that I wasn't sure that like following oncology or rotating with oncology, how would that help me for my for my residency application, because I'm going to apply either internal medicine or family medicine, to be honest. But I choose family medicine because I know that I'll be doing primary care. I was interested, so that's why I thought family medicine would be the best choice, because I know that family medicine does more like outpatient than inpatient. But I interviewed with both of the program for family medicine and internal medicine. But I think rotation wise, so then from the oncology, as a foreign graduate, I always tell my other co-fellows and my juniors all the time that, beggars are not choosers, although it sounds bad, but whatever comes to your plate, you should accept that. So, and I think every experience is a plus, nothing is a negative. So as the oncology rotation comes to my plate first, so I thought like, okay, I would accept that. And while doing the oncology rotation, I actually met a couple of primary care physician, internist, as well as like a family medicine specialist. So I talked to them, and then I did at least 3, because I know the application criteria is basically at least 3 recommendation letter from either internist or primary care physician. So then I rotated with them. And as it is a very, I think University of Michigan is a very renowned and like almost a very good university. So that letter of recommendation really helped me. That's what I would suggest to all of you guys who are here. Please try to, if you guys try to rotate, and I know like some program also you guys probably have to spend a lot of money for that or whatnot. If not, even please try to rotate in a academic institution where either you can get a letter of recommendation from a faculty, which put a lot of values other than the community program. And also like the best would be like the program you're targeting basically, or you would like to match. So by that way you can make impression that like while rotating with them, or like you are gonna interact with the resident, because resident if a resident basically recommend you, that makes a huge impact for your application. Because it's like I now I can tell actually. So it's like, so it's the only way that you can communicate with them. You are gonna rotate, or you gonna round with a with a faculty who is going to basically at the end of the day, which if that person likes you and resident likes you, you have a great chance to match there. So I mean, rotation wise, please choose it like very very wisely, and specifically academic institution, or if it is a community program, make sure they have a residency program that you would like to match.
Thank you so much. Any questions from the floor?
Excuse me, I have a question with another thing. Dr. Sumi.
Go ahead. Please go ahead.
If I ask you what the most help you to get match in your top choice program, like the first 2 option or the first 2 strong point, like help you to get match in the third time in the top program you like.
So your question is like like how did I match to my topmost priority, or how did I, like, what are the most important factors that help me to get
Yeah.
to my,
What
okay.
was the most important factor that helped you to get match in the first option or top choice? So
Okay.
other resident or a future applicant can follow your path and step and work on it.
Sure. That's really a very good question. So I would suggest that like, see, as I mentioned that I was kind of, when I was applying, I was kind of geographically limited because of my family, that I have to apply in such and such a state. So I targeted basically a couple of the programs which is closest to my home, and then I try to basically rotate with them. So some of the program, as after this pandemic, and at that time it was a pandemic actually, so they do not allow any rotator, specifically in foreign graduates. It's very hard. Even like American graduates also, now I came to know the medical student, there are lots of rotation are virtuals and things like that. So it was very challenging situation that I can rotate. So my idea was I want to connect with them and I want to make an impression. So actually, what in my situation, what helped, that was a community program, and that program, like, they have a kind of a a research project program. So they offer a research project. So as I was a MSU public health student at that time, and also I finished my USMLE. So I prepared I prepared and I wrote a grant proposal, and that research project was accepted. And I think, as I mentioned, it was the right time in the right place, because that population was like underserved population. So there's people actually needs those education, like how to overcome vaccine hesitancy. So like I really worked hard on that. And also, when I went for the research project, I asked them that can I rotate at least the resident physician for their program, because by that way I can communicate with the patients and I can talk to them about the vaccine hesitancy and about my program. Luckily they accepted me, and then the program director and the other faculties, they actually saw that how did I communicate with the patients and how my project is well. So by that way I really made an impression when I applied. So they actually kind of knew me very well. So I would suggest the most important thing for you guys is, like, make a impression. If you can make a impression on your own to a program, that's the best thing, that you have a great chance of matching there. Rather than, I can understand it's very hard to, if you interview for, let's say, 15 programs, it's very hard for you to create an impression or communicate with them. Probably you might get an interview through your friends or friends or whatever, not, but you cannot, that somebody is basically advocating for you. But when you create an impression that you are advocating for yourself, your work is talking regarding you. So that's a great chance that you would match. So that's why I'm advising you all that if you target at least 2 or 3 programs, that would be your first choice. So you should definitely try to communicate with that program. Either the best thing is, either you should try to rotate that program, or if they do not allow, try to communicate with, if they have a research project or somewhere else, something somewhere. Even you can, I think, if you email them like, hey, I am, like, close by to your program, blah blah blah, I think this is the best match for my whatever the credential I have. Is there any way that, ahead of time, even 4 months ahead of time, is there any way that I can meet you guys or something, like, or I can know a little bit more about this program? I mean, a lot of American graduates does that. I did not know that actually before that, before my like before match. Literally now in my LinkedIn profile, in my social media profile, I literally received many messages from other candidates like, hey, how is your program? I am very, I like your program a lot for this reason, blah, blah, blah. Can you, if your time permits, can we meet, or can you talk to me for 5 minutes? I think that's not a bad approach. You might approach those things to 10 people, but at least 8 will reject and 2 will answer. But you need one program to match. So always remember that, like if you still even some people even match it with one interview. So you never know. So I think the most important thing is contact with the program, communicate with them, and then make a connection and make a relationship with them and make a very good impression with them. So that would be the most thing. I mean, that's help for me, and I think that help for anybody, because that's how American grads, they actually rotate every programs and they made their impression, and then that's how they got the program. For us, it's very difficult because most of the program now do not offer any kind of rotation. It's very hard to get a rotation, I know that, but but try your best to communicate. Even some of the clinical faculty, they have their own clinic, they might have 2 or 3 other clinic, so you might go there at least once a week or twice a week, and then communicate and then try to do something, even not even clinical work. You can work there as a medical assistant or something like that. That might help, I guess. I hope that answer your question.
Yeah, thank you very much. This is really helpful.
Any other questions?
Thank you for the presentation. Actually, I have one question. Is in my situation, I recently immigrated to US, and I'm working on my USMLE STEPS exams, and I'm struggling between, should I finish the exam and rush into applying this match this September, or should I wait, knowing that I am a very old graduate? I graduated in 2013 from Sudan. So I don't know what is the best thing that I can do. Should I just rush into having a step 1, step 2 exam before September, or should I just take my time and wait? I don't know if you can just help with that.
Sure. As I said, like everybody's situation is complicated, but as your situation, you said like I think a 2013 graduate, so which is more than 10 years by the time you'll apply. So I would say like waiting another 1 year is not gonna hurt you anyways, because you will be considered as a older graduate anyways, but you should really prepare well for your exam. I think now when I took my step 1 exam, it was not pass and fail, it was a scoring system. But as I know now, it is probably a step 1 is a pass and fail. So make sure you passed all the exam. As a foreign graduate, always remember that more than 10 years already is a negative, it's already a red flag. But that's not the end of the game. As I mentioned, you can match even in neurosurgery. I'm telling you, when I was not in that situation, it is rare, but it is not impossible. So and of course you can I don't know like which specialties you'd like to apply, but definitely for primary care and psychiatry you have a great chance. But my question is like prepare yourself very well. Make sure that you passed all the exam in your first attempt. Step 1, as there is no scoring system, so make sure you pass in your first attempt. For step 2, try to make sure that you have a great score. I would say at least like a average. It says always better to the highest score, like a very good score, but at least aim for like the average score, which is like 230, 240 now. So and then prepare like pass all the exams. In between, try to have some connection and communication, and then prepare very well for like letter of recommendation, because that's the thing makes you, in your case, that's the things makes you or breaks you, because letter of recommendation makes a huge impact on you. Because as a older graduate, they might think that you might out of like clinically for more than 10 years, you might forget, you might be not able to like, because residency like first year is very very stressful, because like you have to work very fast, you have to know the EMR, you have to know the patients, like it's a lot of things you have to learn in a very fast pace. So that's their, I think, I mean it's fair, because that's their only fair that out of you are out of medicine for 10 years, like practicing medicine for 10 years, and this is a new system, how you are going to match that. So that's help you when you work in a community clinic or in a clinic, and if a mentor or the clinical faculty wrote a very good letter of recommendation for you, and that's also helpful for you. That's going to boost your experience. That's going to boost your confidence actually when you go for the interview. So, I would, in your situation, I would suggest you prepare very well for the exam. Try all the exams, try to pass all the exams in first attempt, try to get a very high score, and make sure your letter of recommendations are very great. And if it takes one more extra, if it takes one more extra year, that's not going to harm you that much, because as you mentioned, this is already more than 10 years. So imagine that one more extra year is not going to hurt you. But instead, if you apply very fast and, rush for the exam, God forbid, if there is a red flag, like any attempt or anything like that, that's going to hurt your application even more. Even you may probably have to like wait, like couple more years. So it's better to prepare better in 1 year and then prepare properly and then apply.
Thank you. Appreciate it.
Thank you. I also, in the chat box, I can see a question that somebody, I think Lena, that regarding my publication, and her question was, does the publication to be in the same field as the residency program you are applying for? Not really. Most of the publications is regarding basically oncology, because as I mentioned, like I was working in an oncology department for the research. So, my research was in oncology. So now how did I connect with my primary care? Like when I went for the interview, let's say internal medicine or family medicine. Internal medicine is very easy. You don't need to basically tell them that, like what you would like to go or whatever. So when I went for internal medicine interview, I said like my primary goal is to become a primary care physician, but I make my application in different way, because the program, you have to search the program very well. That's the art of the interview. So when I go for let's say community program, and that program, probably that area, they need the most primary care physicians. So they literally, if you want to become an oncologist, they might not give you the spot, because their aim is basically they want to train more primary care physician. So when I went for that type of interview, I said like, my goal is now, basically I want to become a very good primary care physician. But why did I do oncology research? Because, I did not have much experience about American health system. So I would like to know the American health system very well. So that's why I joined a research program where I can have the access for the patient data and, know the things like how this works. And also I have the opportunity to go to different programs, presentations, skills and all that. So all this experience makes me a better candidate for any residency program. And also like, in oncology, the one I was doing oncology research is very important in order to become a very good primary care physician, because there are lots of screening and what's the outcome of it. I learned those things from the program. So it depends on like your publication, you can sell it in different way. Even if I have friends who did a radiology research but finally ended up with match in like, either internal medicine or family medicine. So same thing, you can make your own story. It does not need to be necessarily with the same. Of course, as Dr. Nadir mentioned in the beginning, you say that I also work for, I have multiple like articles published regarding primary care, like specifically like, obesity and then diabetes, hypertension, geriatric research, and like I also wrote like how to become primary care, why the primary care, becoming a primary care physician is so important, those things in different journals and whatnot. But I think like any kind of journal, any kind of publications is important, because on average, you guys will be surprised, on average, even American medical graduates, they have 5 to 10 publications by the time they applied for the residency program. So it's kind of, as a foreign graduate, it's kind of requirement now that they expect as a good candidate that, you should get some publications for sure, because that's how how to write. Even during residency, it's a requirement for SCGME that we have to do a quality improvement project, that you have to develop a quality improvement project. and that project has to be like literally lead by a resident, and then you have to present that. So and you have to understand, always you have to upgrade yourself by reading lots of journals and lots of upgrades and lots of like recommendation and guidelines. So if you do on your own, if you publish on your own, so the faculties knows that you'll be able to understand those guidelines better than the person who never had experience of publications. I think that helps. The other question is from Sarah, I think. How competitive is pathology specialty? Honestly speaking, I never applied for pathology. I'm not sure, but I think I have a couple of friends who, when I was working as a researcher at University of Michigan, at that time I met a couple of international medical graduates. They're doing pathology residency, but I think for pathology publication is because there is not much clinical rotation you need, but I think you need a huge experience of at least publications for pathology specifically. And also you should apply for a program, or you should do a rotation or shadow or something that academic university where do they accept lots of foreign graduates, and also accept a good foreign medical graduate, and also they have a opportunity, they can offer you opportunity for a research experience. I think that should be your objective, because most of the pathology specialty, I think at least they require a little bit of research experience. I hope that helps. But as I applied always, internal medicine, family medicine, and neurology, so I am not really very experienced about pathology. Anybody has any other question? I'm sorry if it is taking a lot of time, but I really
have
try
one more question.
Yeah, sure.
So I see that you attended the Michigan Academy of Family Physician annual conference in McKay Island. Can you shed some light on your experience there and how attending these conferences can help you make connections and networking?
Oh, absolutely. So actually, this is the American Academy of Family Physicians. There are two affiliations that I am already enrolled. One is AAP, one is MAAP. So my fellows here who are applying for family medicine or internal medicine, you at least, I suggest you guys please go for one meeting, at least one national and one international conferences. Every, I think for internal medicine it is ACP, which is regional, like wherever you are located, every year they have a ACP, which is a regional conference, and they also have a JAMA, or American Association of Internal Medicine, that conference as well. Please join one of these conference. I'm telling you, nobody suggest me when I was applying for residency at that way, but this is huge helpful, because you're gonna basically meet with lots of faculty, lots of resident, and lots of program director. So you are going to connect with them. You have the opportunity to talk to them and have some idea about like how program works and what kind of candidate they are looking for. Also at the same time, you're gonna learning a lot actually. So my whole idea was that as you guys know that during residency, joining even a in a conference is very, very difficult, because in my any kind of during my residency, whenever you are actually when you are rotating any inpatient rotation, I'm not supposed to have 3 days off, so that's very difficult. So I managed to go to a MAFP, which is Michigan Association of Family Physicians, their national meeting. Why I did that? Because my goal was, as I mentioned, that I want to become a clinical faculty, and it's not easy to find a clinical faculty job wherever I'm going to live in 20 miles. So I want to make sure that, I am in a right place, and there are lots of recruiter over there, and I contacted with them, and then I met lots of faculty, and also the PD. So wherever the residency programs are, so I communicate with them and I said, hey, I'm going to finish my residency in next year. So if you guys looking for any faculty, this is my CV. So it's a very good networking place, I can say. And also you're gonna see your own people. And then I also had the opportunity to present over there, like basically like I developed a hyper, like that was my QI project, like how food and exercise help and dash diet, specifically diet helps to overcome at least hypertension and how it improves over the time. So so that project I developed to my clinic, where I usually see my patient with my other co-fellows. So I also was able to present that. And my whole my whole, including my hotels fee and including my all reservations and rentals, everything was paid by my program, as well as my scholarship and everything. So you guys, when you guys are doing all those things, there is lots of loophole. I know as a foreign graduate it's very hard to probably manage those things, but please make sure, like if you can find some of the programs, some of the things, they always sponsor a medical student, they always sponsor like lot of things. So you can, if it's, and even if you have to pay from your own pocket, it's worth it, I'm telling you. So it was a great experience for networking, for learning. And also I think this is like it's a great place to communicate with your with your people who are your same specialty, and you're gonna learn a lot. And it helps in your future career as well. I think there is another question. Oh, no, it's not a question. Thank you.
Any more questions? If not, perhaps you can share your contact information if there are more questions down the road, if you don't mind, Dr. Sumi.
Sure, I will do that. And also I wish you guys all good luck. And I know the matching time is like approaching. It's probably in a week or two, and everybody is so stressed. But whoever you guys will match, good luck for you and good luck for your future. Also I would suggest, like after match there are two things. If you match, you are all set. But from March to July fast, please make sure that you prepare yourself well for day one, and at least day first month. There are a lot of, if you match to internal medicine, try to communicate with your senior or resident. They can help you out, like every hospital has some guidelines and protocols, if they can send you those things, so you can review all of those, so what are the things. Because at your day one, let's say internal medicine rotation, or you may be rotating ICU on your day one. So if all those protocols or guidelines, that would be little bit, you'll be little bit confident than the other people. So please, like proactively communicate with your co-resident, or who will be your senior. Try to go to their website and then find out, and then, hey, I matched into your program, blah blah blah, please try to help me, whatever the things you guys have and what is helpful. That is one tip. And also, like do your like just refresh your memory for the CPR, AMA, ACLS, BLS. Those are the protocols you probably need, specifically who are family medicine or internal medicine, doesn't matter. You probably end up like first day of internal medicine or ICU rotation. So that is a little bit small tips for your day first month for those fellow. But those who are not matching, who don't match, please try to you do not have even a day to spend like, oh, why didn't I match, or cry and everything like that. Please make sure that you are prepared well for the next match. So make your strategy, and then divide your time, that what you want to, why you didn't ask yourself and analyze yourself, like why didn't you match, and what are the things lack. Even you can actually if you interviewed in couple of programs, you actually can email to your program director, like what are the factors do you think lack in my CV that I should improve for next year. Actually they really appreciate that, because they thought like you are a real candidate. they might consider you for the next year. Actually, it's not like uncommon that people get interview in second times and they get actually match for the program. So that's kind of like you should whoever, like wherever you get interview, you should and definitely they can remember you of very well, or you can go through the thank you letter and then reply on that, so they might know that, oh, okay, we interviewed this candidate. And also just before applying, if you reapply that program, you can remind that I applied, but this is the things I did from last year to this year, so they know that you are dedicated and you try to improve yourself. It's not like oh, she applied and then she didn't do anything. The most worst thing I would say, like if you apply with the same application multiple times, that's gonna hurt you, because that shows that you did not try to improve yourself basically, and you just reapplying one after another. But you at least you try to do something that really helpful. So that's my couple of tips. But anyway, I'm going to give you the and Dr. Nadir definitely have my email address and everything, all the contact information. If you guys any help or anything, any questions, I'll try my best to help you. You guys can find me in LinkedIn or Facebook. If you guys have any question, just make sure that you texted me that you are a telegeriatric fellow, so I knew that where you're coming from. With that, and thank you so much for inviting me, that I thought I was able to help you guys. And anytime if you need any help, please reach out to me, and I wish you all good luck. Thank you, Dr. Nadir, again. Nice to meet you and nice to see you after a while.
Thank you so much, and nice meeting you as well, and good to see you. And we have one more topic. If you would like to stay along, you are welcome. If you are busy, we understand, but I really appreciate your time, your tips, and your sharing your experience. Thank you. Have a wonderful day, and be in touch. Good luck with your residency, and congratulations for getting the job like a faculty member. We'll be in touch in the future. Hopefully, we can collaborate.
Sure, absolutely. Thank you, Dr. Nadir. Have a good day, everyone.
You too. Bye-bye.
Bye.
So our next topic will be about the tool that's Gamma. And Dr. Aseel, when you are ready, you can go ahead and share your screen and teach us something about Gamma. Thank you.
Hi, I will be sharing today a few tips on how to deal with Gamma AI. First, I would like to thank Dr. Nadir and the faculty and the team for introducing this. لأنه it's a new tool and it's very creative and collaborative. I.e., I was really, to be honest, it really exceeded my expectations. So to make things easier, we can start by typing the address, which is Gamma AI. We can open it here by the app. I already signed up, and that's my account, but we can move forward with how the AI first appears. So when we type Gamma app, here's how it shows. This is the screen. This is the introductory screen. And it says you have ideas, Gamma brings them to life, and it truly does. To start, first of all, we have two options. We can sign in via Google, and this is my preferred option, to be honest, because I link everything to my Google account, so that can be easily retrievable and recallable. However, if we want to go through a step-by-step approach, we can use sign up for free. When signing up for free, we have, again, two options. We can sign up, continue with Google, or we can write our emails. I think it would be unnecessary to go through the email approach because it will include the same things, email, password, etc. Google as I prefer usually. This is my free account, free email accounts. I prefer this account for any for most of the professional things I'm doing. So because the account is already set up, I have spent the last 3 days playing around and discovering what's up and what's down, what's up and what's down on the app, what's happening, the templates, the options, and everything. So this is the primary platform, or this is the primary, I don't know, this is the primary screen. We have these options. Over here, it tells that this is a Series H workspace. I'm choosing the free option because I'm not about to pay yet. And here it just shows you everything, like the gammas and the workspace that you're working with. If someone has shared a presentation with me, if I'm sharing it with someone, etc., etc. But as this is a new account, so I haven't shared it with anyone. But I will share my referral link if someone wants to collaborate with me on any other presentation. This is the sites. Again, it's a beta version, i.e. it's still under development. Here we can create a site, but at the time we don't need that. So here the template, the inspiration, etc., etc. We will get to use them as we go forward when using our presentations. So I can go back to the primary screen. Here it is. On the right, on the top right, here we have the account itself, and there is something here that's called credits. The idea is that this is a free account, so we have limited credits, and each credit entitles us to have a specific thing. يعني احنا عندنا عدد محدد من الكريدتس. عادة الواحد بيبدأ الأكاونت حقه ب 310 360 بيختلف يعني. فهي بيكون فيها يعني it's like a game. The more you use them يعني you can use the credits and you can build the credits. So it has this game approach that I truly admired because as I started I had 0 credits, and then I tried every feature here and there, and then I built up until 310 360, I'm not sure, and then I used them up creating these presentations over here. And I will continue to use them up as we go forward. But if I wanted unlimited credits, I have 2 options to pay. The payment, as we see here, can be done monthly or yearly. The monthly option is $10 per month or 20, depends on the features one prefers, like Plus or Pro. So it's actually really exciting. طيب السؤال هو إنه ليه أنا ممكن أدفع لحاجة هي موجودة مجانا؟ وصراحة ده سؤال جميل شديد يعني. الفكرة إنه the free account gives you only 10 slides. The Plus account gives you up to 20 slides, and the Pro account gives you up to 50 slides. So mostly, if someone wants to make a lengthy presentation, who wants to make a presentation that tackles many subjects, 10 accounts wouldn't be sufficient, 10 cards wouldn't be sufficient, 10 slides won't be enough. So most people like pay for that, which is 10, 20, يعني on the margin of affordable. So it's a good thing. There is the yearly plan, and if you are using presentation in your everyday life, that would be a smart investment. But for now, I'm sticking to the free plan. Okay, so إحنا هسه عندنا الفري plan هنقوم نعمل بيها إيه؟ هيكون عندنا like options, create new AI, أو ممكن we create a presentation from blank. Okay, if we chose to create presentation from blank, it will be like a normal presentation. Okay, it's just a slide, and it gives you slides, and we can choose whatever slides we want, but I think up to 10. Okay, we can try how many slides we want in. Add blank card. Blank. نشوف. Okay. Ooh, okay. So if we have a slide that is done manually, we can use more than 10. دي information مهمة شديد يعني. لو هنعمل كل slide إحنا برانا, or we will create it on our own, we can upload more than 10, we can upload 20, we can upload more. But as long as we are using the AI feature, في الحالة دي إحنا هنكون محتاجين لأنه ندفع عشان ناخد الترم التاني. For using the AI feature, we're gonna need we're gonna need to pay. So here's the create new AI, and it's such an interactive platform. Like it's so colorful, it's so energetic. I love that. So بيكون هنا عندنا السكرين, and it's so powerful, it's so nice, it's so mesmerizing. And you have three options. The first option is to paste in text. Like if you have notes, if you have something that you are already planning to paste, we're gonna use that. Or there is the generate. This thing is like نفس الفكرة بتاع ChatGPT. Like you log into ChatGPT and then you say, okay, do this for me, do that for me. مثلا تقول له write discussion, write بتاع, and then it just does it. So it's really amazing. And then there is the third option, import file or URL. I personally tried both of them. I haven't tried the paste in text yet, but we can always have time to discover more. The generate, you give a prompt. A prompt is هو بس فعل أمر. You just give them, you tell them what you want to do, and then it does it for you. So 7 hours ago, I asked it to make a gamma demo for medical researchers and make it fun and academic. I used this prompt when I did one and said, help me create a demo that will grab their attention. So that's the prompt that I used. And once I put that prompt in, اختاروا لي عدد الكاردز اللي أنا عاوزاها. As we see, it's up to 10 cards. If we want 20, we have to subscribe to Plus. If we want 50, we have to subscribe to Pro. So, okay, 10 is fine بالنسبة لنا. بعد ذاك بنتكلم عن the size of the card itself. Do we want traditional, tall, etc., etc.? Then there is the language. Here we have the option to edit the prompt itself. We can just delete the attention part. We don't need the attention all the time. Here is the outline. Okay, so the outline is for 8 cards. And I said I wanted 10, so I'm not sure if they can fix it or not. Here are the themes that are available. There are plenty of themes. Here they provided us with 6, but we can view more, which is really fun. Oh my God, look. And then you can choose the theme. Do you want it to be colorful? You want it to be professional? I know it's better to have it professional in these settings, but I can't deny that I'm young and colorful, so I will choose the colorful option.
You can
And
hit regenerate when you are ready. You can go back up and hit
okay,
regenerate to create the 10 slides.
okay, I will definitely. Thank you. When you are ready, I will just choose the generate and it will be a 10. Okay. Here we have the context. It's brief, a text, or medium or detailed. I always prefer cards with brief amount because it's easier to grab the attention. It's usually more difficult to observe when you have a lot to write. Like people divide their concentration on the text or on the presenter. So I prefer brief. Then there are the image sources. We can use them automatic. We can use stock photos, like the ones that are usually on Google. Here they're web images. They're also AI images. I don't prefer them, but they can be used. Here they can tell us the image style if we chose AI. We can use color, styles, mood to use, or etc. I will stick to illustrations because it just gives a more professional attitude. Below that, we have advanced mode, which is a bit more advanced, probably. It changes the settings a bit, but it's usually, you have tips over here, you have additional instructions over here. These are the same thing. They asked me if I want to write for graduates or postgraduates. I chose for postgraduates, and then they asked for the tone. I asked the tone to be academic, and this is the image, this is the presentations. So here we can press continue. Pum, 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 pum. So when pressing continue, we can choose the theme again. I chose this one, and then we can use generate. Ooh. It's really fun because it gives you like بيوريك كيف الجنريشن بيحصل so it's a bit dynamic بتكون انت شايف كل كلمة بتتكتب you see the words getting written you see how it's working and it's really nice it's really dynamic as I said so am I satisfied? I'm very satisfied to be honest but it's 8 why is it 8? Okay so here are the 8 slides that were done so this is the first slide. The first slide, it said unveiling gamma, a novel approach to etc. etc. Medical data analysis, which is very relevant to the topic because we as doctors and researchers, we need presentations mainly to present our data when we're presenting our abstract, we are presenting our posters, or even when we're presenting a topic on the weekly Saturday meetings. Here are the illustrations. They're cutesy. We have an illustrative image of the brain, I think. Or is it an eye? I'm not sure. It's just something. If I want it to be changed, it can be changed, I think. It can be edited. And then it tells stylized brain with data streams on it. So this is the prompts they use to make this illustration. And we can choose to edit it if it does not fit us. It truly does not fit because it's very difficult to tell that it's a brain. So we can change that if we want. We also have this option here on the left corner to change the card styling. We can change the layout, the top layout, or make it the image on the left, make it on the right, make it the background. I prefer the background option more. And then we can choose everything other than that. We can choose the image to be full bleed, the card to be full bleed, to be less than that, the width to be medium, to be large, the content alignment. The overlay color, if I want something specific. Here you go. If you want it to be faded, to be frosted. Ooh, it looks nice. So this is the styling. If I hit the styling as a whole, I can reset it. And now we're back to the same style. It's not the same one, but it's different. We can also choose edit with AI. When editing with AI, we can have these much options. There are a lot of them. We can convert it into timeline, just like this one. You think? We can translate. We can fix spelling and grammar. So I prefer to look at translation. From English, we can try Arabic because that's let's go. طيب تشجامة نهج جديد لتحليل بيانات البحث الطبي. It's not the best translation out there, but it's good enough for something automatized and AI, especially that AI is usually done in English and built in English, so we cannot expect it to be as good in Arabic. Here on the right corner, we have notes if we can add them. These notes can be done and be shown in the presentation itself. We can close the notes. Okay. Okay, so here we can add a blank card, or we can add a card with AI. That would be really interesting. Ooh. Again, this is a beta option, i.e. it might appear to some and might not appear to the rest, so I'm not sure. If we want to generate a card, we describe here what we would like to make. Okay, let's go for future challenges as I think that can be made. And then let's go. Ooh, it already automatized it. Future challenges, scaling data and processing, etc., etc. Okay, I don't like this robot, but we can change it. What's really interesting is Whenever we're choosing anything that has to do with AI, we're using up our credit. So that's really interesting. It gives you this thriller of a game, like, oh, I'm here on a task. These are tokens. I'm collecting them. So that's really interactive. We can fit the image. We can remove the image. We can edit the image. We can delete the image. Oh, okay, خلاص. I can do Control Z because I like the image. So lastly, but not last, we have two things. We have two more things to discuss. The option of embedded. We can embed content into our presentation. We can embed images. We can embed videos. We can use apps and web pages like Google Drive, Twitter, Instagram, anything. I think I used Google Drive to embed specific URL last time. There is also an option for embedding YouTube videos. I used the YouTube videos out of here. This YouTube video, I probably used it. Okay, here we go. If you want this, so this is the video link. Control C. We can just turn it off. Okay, let's go. So yes, here we go. Why is it not okay? Please. Okay, so here we have the URL. Control V, and then we can go. So by that, we already find the video embedded in our presentation, and that's a link. So that's really nice, and we can use other options as a link, as a button, or as a preview. I prefer to make it as a preview. And here we go. We have the last option is to present. This is the last feature that we can manipulate. We choose the presenter mode, and in the presenter mode, we can choose an option of spotlight this block. Here we can have a more dynamic, or we can animate the content of our presentation by moving the spot block according to our needs. Like here, we're putting the spotlight on future challenges. Then as we move forward, specific segment of the card or the slide is highlighted. Scaling data processing, enhancing the privacy, expanding applications. And here we have our YouTube video. So we move backwards. We can also cancel this feature and turn off the spotlight. And here it can just be animated in the way it's supposed to be. Everything is showing up all at once. So that's fun as well. So I think that is all the content that we can try for someone new to this app or new to this AI option. As I said, it's much more interesting than any other AI presentation tool I've used before, and definitely more interactive than Google Slides or PowerPoint. It also has the option to share across different platforms or different apps. So we have the share option. The share option, we can add emails. Here I can add my other email. We can also share it by copying the link. Ooh, okay. We can export it as a PDF, as PowerPoint, as Google Slide, and as an image. We can post it directly to LinkedIn if we want. We also have this option of view analytics. We can share what's happening and if someone viewed this page before, if someone engaged with a specific card, etc., etc. As we see, I have spent most of the time on the first card, so it's shown over here. Really nice. The last option is embed. If I want to have the code, or if I want to have the link and to embed it on other websites or other tools like Twitter, maybe, or maybe into my own website that's designed by Notion or designed by, I don't know, HTML or any other option. I see. So here is the done. This is the sharing option. خلاص. It's enough. I don't want to share. Okay, it's done. طيب, we're back to home, and this is where it all started. I have made about 7 presentations so far, and they have all been more fun to do it. I can share my presentation, I can share my referral link, I can share anything. Okay, we can talk about referral if we have some time for it. I'm not sure. Here is about the credits. And you can refer a friend, and you get 200 credits. You can invite a teammate, you get the same amount of credits, and these credits help you generate more AI. So it's a fun, dynamic option that can work across teams and work across groups. I hope you enjoyed this presentation and enjoyed listening to it and having it as much as I did preparing this. Thank you so much.
Thank you so much, Dr. Aseel. And with that, do you have any questions, any of the fellows to Dr. Aseel? It's very useful tool, and hopefully you will find it useful or helpful to you when you are preparing your presentations. If no questions, we can move to the last part of the meeting. Updates. Any of the fellows here wants to share any updates or any questions or suggestions? Please feel free, raise your hand, or you can start talking.
Hello? Dr.
Hello, go
Nadir,
ahead.
can you hear me?
Yes, Dr. Rana, go ahead.
Hi. I just wanted to ask, I have an idea for a neurology literature review, like a narrative review, in epilepsy, and I'm wondering how can I like create a team or a group, because unfortunately the group I'm in, they're a little busy and inactive. So I'm wondering, is there like a way to create a new group, or is there a way to approach others, or how do I go about to start this literature review?
Great question. So I'm going to share the screen here.
Okay.
If you go to the app, at the bottom, there is an option of projects. If you click on the project, like add new project, you can state the title or description of the project. And if you have previous team members that interested, you can add their names, or you can just click here to activate this project to be shared. If you have an image about the project, and the status will be new project, and then if you hit OK, submit, it will be listed like these ones. So as in the WhatsApp group, the big group, you can start share that I have a new project. You can find it and you can add a number, for example. Tell them project number 13, for example. And then each time a fellow is interested, they can go here, they can add their names, and it will be listed the team members here. When you or the new member add their names, they will have the option to select the roles that they want to play. For example, you will be the project leader or manager. So you can hit here. If you are interested in a specific part of the project, like you want to be the submitter for the abstract, if it's an abstract, or you want to present that project, or you are good with slides and preparation. So maybe you want to do the poster presentation, or maybe you can do more than one. So you hit whatever task you think you want to do, and then you submit, and then your name will be listed here, and hopefully we'll have the role or roles here and the email. So you can create an email list. You can communicate via WhatsApp group or Telegram, and then you can start working. So the idea is if you have the research question and you want to make it as a new project, you can do it this way. The method you said systematic review. Then if you know how to, you can divide it into small tasks, and then as the team build up, and then you divide or you assign these tasks to the team members. Some team members might not be available right now, but they can be available in 2 months, for example. So for these fellows, you can assign them something later on, like they can write the abstract or they can submit the abstract if you are planning to do it as abstract. Or they can do the manuscript editing later on. For the available fellows in the team, you can assign them the task, like if you have one task to search the data, collect the information or collect the studies, another fellow will be analyzing these studies and so on. So there are steps to do the systematic review. So you can assign each member one or more tasks, and they can work into pairs. For example, 2 can handle one task or more can handle one task. It depends on how many fellows in your team and how they are available, how much time they want to spend. If a
Okay.
specific question, go ahead. Yes.
Okay, that's very good to know. Thank you, Dr. Nader. And if regarding like supervisors, can I find people that can help guide me? Because it would be the first time to do a narrative review. I've done like case reports and quality improvement projects, but this would be the first narrative review. So I'm wondering, how can I like conjure supervisors or so? Dr. Nader, I can't hear you.
Okay, thank you for the question. So if you go to this website, TGRF publications slide dot
Mhm.
page, it will have some conferences or abstracts that we submitted, some of them systematic review, and you can go to, for example, this was done by Lina Al-Ata. So you can approach Lina or Sarah, Said, or Lubaba, for example. All of the 3, they did a systematic review. So most likely one of them will be available to guide you about what's the steps, how to do that. So to find their, let's say, their emails, I think you can find them somewhere here in the seniors.
Senior fellows?
Senior fellows, you can search for them. If not, they will be most likely they matched. So I'm not sure what happened here, but it's supposed to have a list similar to the fellow seniors, and you can see if I want to see Hatil, for example, this is one, and you will get the contact information down there.
Okay, I see. Perfect. All right.
Or in
Thank you,
WhatsApp
Dr.
group, they
Nader.
can you can find their contact info as well. Thank you.
Okay, great. Thank you so much. Thank you.
Appreciate. Any other question? And good luck, Dr. Rana. Any other questions?
Thank you.
Any other fellows? Any suggestion, questions? Go ahead, Dr. Aseel.
I was asking if we have any ongoing projects or fellows interested in oncology or radiology. If there is, I couldn't find on the website from the first look, so I'm asking and wondering.
So I think if you go here by specialty, maybe no. We asked fellows to show their interest. It's not listed here, but I'll update the app so that you can have, if you click on interest, I think by specialty, you will see those who are interested in specific area, family medicine, radiology, neurology, something like that. The other option is to send it in the WhatsApp group, and then like Rana, if you are specifically targeting a project, just update that project and tell other people to join you in that project. Thank you.
Sorry, Dr. Nader, I just remembered one last question, if you don't
Yes,
mind. I
sure.
wanted to ask, I used to see like updated grand rounds for neurology on the app.
Yes.
The last update was February 14. Are there any like new
So
updates for the grand rounds?
yeah, so if you go to the homepage, usually it's somewhere here. So I didn't update the recent one, but usually they are on Friday, and you have the same link, so they don't change the link. So if you go down, I think you can find the link somewhere.
Because I couldn't find the link. I didn't know how to join.
Sorry. Let's see. No. Okay. I'm gonna update that. Sorry.
Okay, no
My
problem.
fault.
No worries.
No worries. I'll update the grand round. So the neurology is on Fridays, 7:30 in the morning, and you can just keep the same link. You hit that. For grand rounds in internal medicine, they do it on Tuesdays, noon time, Eastern time, every other Tuesday. So, and the
Okay.
link will be there also. Thank you.
All right, perfect. Thank you again.
Appreciate. No problem. Any other questions or any other comments, suggestions? If not, I'd like to thank you all for attending the meeting, and especially I'd like to thank all the presenters from today meeting. I hope this meeting was helpful to some of you, and I'd like to thank those who will watch the recording in the future, and hopefully this will be helpful. Thank you again. Have a wonderful day or night. See you next week. Assalamu alaikum. If you have questions, please reach out via email, text, or call me. I'll be happy to help as much as we can. Have a wonderful day or night. Then Assalamu alaikum and Ramadan Mubarak. See you next week.